Well, good morning and welcome to our 42nd Coffee with the Commissioner event. We do this on a very frequent basis. Typically, we would do this out in town at McDonald's or Hardee's or Denny's. But of course, during the COVID pandemic, we have to do these things online, and that's just what we have to do. But we're here, and we're glad that you're here as well. And this morning, we're very fortunate that we have special guests. This morning, we have State Representative representing District 2, Alex Andrade is here this morning with us. And we also have Escambia County Administrator Janice Gilley here as well. So we're really happy that you're here. We're happy that we have our guests here, and really want to get things kicked off this morning. What we typically do is we allow our County Administrator Janice Gilley to kind of give us an update on things that are happening in the county or things that happened over the weekend. And I know, Janice, we had a huge weekend at the beach. Everyone was wondering what would happen. Why don't you give us an update from the county's perspective about how that all went down? And good morning.
Yeah, so we had about 90,000 cars that actually went through, the toll booth. And so that was our record high for the last couple of years. And I think as we, like I like to say, I think we continue to put 10 pounds of croaker in a 5-pound sack on the beach, even though we have 8.3 miles of our beach. And then you also have the Gulf Islands. I think we can all see that there is a point at which we have maximum capacity. And so we don't limit the number of people that can come to our beach. We don't limit access to our beach. And so there are some times when it's difficult to find parking and maybe find a space. But I will say that I know that maybe some of you saw that CNN was reporting from our beach this weekend live.
They did.
And yeah, they were walking up and down the beach, and they were talking about how the folks were properly behaving and, spread out and monitoring the sage advice of not only the CDC, but our governor and others, other elected officials in our community. And so I'm thankful for that. I think that we were a model for the country, probably some good advertising for us as well. Kind of different than what they were seeing on the East Coast, maybe a Daytona or something.
Right.
So that always makes you proud. I would mention that, we do still have COVID cases that are coming in. We still have hospitalizations, but the good news is we have a lot of ICU beds. We have a lot of capacity still available in our community. We are not running into any issues related to ventilators and all the things that about 8 or 9 weeks ago we were so concerned about. So I think we're getting some relief from that constant information related to COVID just as a community. The next thing I would mention is the bird ban. So yesterday the fire chief was off, which I'm very thankful that he had an opportunity to take off. And then today he is going to be meeting with our emergency management director, Eric Gilmore, this morning. And they will also be consulting with the Florida Forest Service and talking to them again. We have had some rain, and we do appear to have some humidity. We are still having some high winds come through the community. So they just want to make sure that all the different weather circumstances are suitable for lifting the ban.
Do you anticipate that that's going to get lifted?
I haven't spoken with him this morning, so I would hate to say for sure, but I trust their consultation and their conversations, and then how they're monitoring the weather. The other thing I would mention is that, there are still testing sites in our community. There's been some movement in those testing sites. So I just wanted to make sure that I got those out there. The ones that we are seeing this week are going to be Gregory Street, 1300 West Gregory Street. We've got one at Sunrise Apartments, which is 4350 West Fairfield Drive. And then there's going to be the one at UWF that's still available. And, there's still the drive-throughs, the walk-ups, those kind of testing sites. So I would encourage folks, if they're still concerned, to make sure to go to those sites. And then last, but certainly not least, I would like to thank Representative Andrade and obviously the rest of our delegation for passing the sales tax holiday for hurricanes. Which, will start on Friday. I know we've been very consumed with COVID, but next week, we kind of have to turn some of our focus to hurricane season. And so you will see out of the county, we will be promoting three key messages. One of them is know your zone. So know the zone that you live in. So if you live in a hurricane evacuation zone, make sure that you know that zone and that you have information and you're ready to go. Number two is know your home. Is your home safe? is a safe place to be. Because of COVID, there will be changes to our hurricane emergency shelters. And so because of that, we may have a little bit more limited space than we've had in the past. And so we are still working through that, but know your home, and your home may be the safest place to be during a hurricane evacuation. And then 3, know your plan. If you are evacuated, or, if you do have a lot of damage or things like that, have a plan in place. We like to say the first 72 is on you.
Right.
And what that means is if we have widespread damage, you need to be able to take care of you and your family for the first 72 hours. And that includes, food, water, things like that, pets, medications, just not because we don't want to come to you and take care of you, but just if it is catastrophic damage, we just want you to know that you are safe and your family is safe for that first 72 hours. And so those will be the 3 key messages that you'll be hearing from us. And I guess I'd add the 4th, which is, like I said, thank you to the delegation for passing the sales tax. Get out there, buy your supplies, be prepared. There are some really good lists that are available. The Florida Senate, the Florida House, and numerous newspaper outlets have provided information on what all's tax-free, and just kind of your preparation list, your batteries, your generators, your ice cold packs, those kind of things that you need to have to be prepared as we move into hurricane season.
It is hard to believe. It is hard to believe it's almost hurricane season. And again, thank you for the update. And as we move through the pandemic and now into hurricane season, the thing that I worry about is, and that you see in the media, is if we get that boomerang effect and we get the second spike wave of the pandemic, and that happens in conjunction with an active hurricane season. Because I think the prediction center out of Colorado, it's funny, the prediction center for hurricanes is in Colorado. It's kind of interesting, but it's my understanding that they're once again predicting a very active hurricane season. So we just pray that it doesn't get too bad, and that we don't get a second spike. But thank you very much, Janice, for that update. And I also want to point out, we had originally had Senator Broxson scheduled for this morning to join Representative Andrade. Unfortunately, he had an event come up and he could not make it. He told me he definitely wants to get on, and we're going to bring him back in a couple of weeks, and he'll be on. And then, of course, we'll welcome Representative Andrade back as well if he's able. But I don't know, after the grilling I'm about to put on him, I don't know if he'll ever want to come back on one of my coffees. I'm just kidding, man. A bunch of softball questions. First off, are you going to cut education funding?
That's a great question. What you're referring to specifically is the $500 million that we appropriated this year for starting teacher pay. And then, we allocated a little bit over $100 million as well to raise the veteran teacher pay. If their pay was already higher than the starting teacher pay that we raised it to. The question.
Do you think is that going to happen? I've heard different things, but you guys passed the bill, so is that a done deal? That's going to happen for these teachers, the pay increase?
So here's the issue that we're facing, right? So 52% of our general revenue budget goes to education. And while our budget this year is safe, Florida's a very conservative state. We obviously have a balanced budget. And while most states, I think there's like 48 states out of 50 that either have a constitutional or statutory provision saying they have to balance their budget. We live within our means, and our state budget, while we have more people in Florida than New York, our state budget's almost half the size of New York's state budget. The problem that we're going to have to be looking at is not necessarily whether or not this budget for this individual year is intact. The issue that we're going to have, the issue that local governments are going to have, obviously, is the tail effect of COVID-19. And what is our general revenue? What's our sales tax income? What are we actually going to collect for the years going forward? Because this $500 million allocation is not a one-time allocation. We're committing to starting teacher pay going forward to be the second highest starting teacher pay in the country. And whether or not we can actually maintain that going forward out of our general revenue is going to be the concern. Because we also gave a 3% across the board state employee pay raise this year as well. So I'm not sure exactly what we're going to do and where that money is going to come from. The base student allocation wasn't raised as high this year. I think we raised the BSA, the base student allocation, the appropriation essentially per student the school districts receive only about 40 some odd dollars this year. We raised it $72 the year before, because we'd given the starting teacher pay outside of the VSA, for some very specific reasons. But how we're going to make ends meet and plan for the future is still up in the air.
Yeah, that wasn't a fair question to throw at you right away, man. I kind of did that in jest, but I appreciate the answer. I mean, you were ready to roll. That was good. That was very good.
Our budget's a big deal. The federal government's, the CARES Act, I think, allocated about $8.5 billion for the state of Florida, between the state itself and the counties that exceed 500,000 people in population. How we use that money, what it can be used for, those are all questions that are still not 100% answered.
Well, let me ask you, while we're on education, last week I had Vicki Campbell from ECUA, and I also had Kevin Adams, the District 1 school board member. And we talked a little bit. I served on the school board for many years and I have a passion for education and kids. And I was curious, though, in the age of the pandemic, and I asked Kevin this question, and I've seen the CDC guidelines where they talk about every other row on the bus and one kid. And I just know that's a non-starter. I just know you guys, you'll never have enough money to do that. So, and I hate to ask this question, but how will we do that? Because there's a lot of folks that rely on that school bus to get their children to school. And I'm just is everyone going to have to wear a gas mask? I mean, what's going to happen?
So if you can think back a month and a half ago with what we knew about COVID-19 and how we thought we were going to be responding, my guess is that a month and a half from now, we'll have a very different perspective. I'm really not sure what Speaker Corcoran I don't know how to refer to Richard Corcoran right now in his new role for the Department of Education. But what the guidance is going to be from the governor and the Department of Education is still up in the air. We're going to know more about COVID-19 before school starts back in the fall. I remember, Escambia County had a shortage of at least 40 bus drivers for our current capacity a year or two ago.
Correct.
So actually cutting how many children can be on a bus at any given time in half is probably not something that's feasible. And it's probably time to start actually working on some of that stuff that Rob Doss talks about, as far as safe walking conditions for children to get to school, and finding alternative methods to get kids into classrooms. But overall, the holistic approach to getting children back in the classroom safely is going to be worked out for the next few months. And I know we'll be prepared. I think Florida got some unfair criticism early on in our response to COVID-19, but the numbers don't lie.
No, they don't. No, they don't.
No matter how much the media might want to say they do, the numbers don't lie. And Florida's done an incredible job in response to COVID-19 to date.
No, there's no doubt about that. In fact, I was going to segue into that. You hear a lot of people saying, well, you should do this and we shouldn't do that, and you ought to do this and you ought to do that. All I know is what you pointed out earlier, Representative Andrade, is New York is smaller than Florida, right? The smaller state. We're bigger, but our budget's a lot less. But here's the critical key. They've had 30,000 deaths. We're at like 2,200, which is horrible. Look, we mourn every life that's lost, but New Jersey, almost 12,000 deaths. We're at 2,200. So I think, Governor DeSantis takes a lot of criticism, but I think he's done things right. Now, a couple of issues, we might locally, our Board of County Commissioners have sent him a couple of letters, like, for instance, opening the hotels, but not allowing the long-term rentals or short-term rentals to be open. We thought that was a dichotomy that shouldn't exist. And and I'm glad that we fixed that, because it just seemed to me, and it seemed to a lot of folks, that you got 100 people in a hotel turning over night after night after night, but I can't rent my beach house that I've invested my life savings in. It just seemed unfair. So we're glad we got that sorted out. Also, the dentists, the dentists could start cleaning teeth with the brushes and the sprays, but I couldn't go get a haircut. It just was ridiculous. So, but overall, I think he's done a great job. And I think you're right. Florida, the numbers don't lie. You guys, the state legislature, the governor, you guys have managed this well, and kudos to you for that.
Well, I'm not the governor. I'm not an executive employee. Right. And so I'm not in a position to have to be an apologist for the governor. But some of these executive orders get maybe some unfair consideration, right? So, I think one thing for anybody viewing to just remember is that these executive orders, they're not legislation, and they're getting attacked like legislation. Being saying people saying these aren't being well thought out, right? So one of the big ones, obviously, like you said, was vacation rentals. Well, hotels for a lot of people had to stay open, right? Hotels by the highway. Governor Sanders even mentioned, he has how many National Guard being activated all over the state, and they have to have places to stay. But when you look at vacation rentals, they're predominantly not for people in vital industries or key industries that had to remain open. They're mostly vacation oriented, and we have a lot of visitors that are international and from hotspots. For instance, my numbers might be wrong, but I think, if you look at Navarre Beach, they might have 60 hotel rooms, but they had over 2,000 vacation rental rooms.
Mhm.
So that executive order, I mean, it's not designed to be legislation perfectly thought out and fair, but it was designed to cut down on the number of visitors from hotspots who are coming for predominantly tourism reasons, while allowing all those key industries, those vital industries, to remain open and have places to go and to sleep when they were traveling around the state. So while some people, saw hotels on Pensacola Beach being open and saw their vacation rentals not being open at the time, that's not why the executive order was crafted the way it was. It was crafted to allow those key industries to remain open. I'm glad Governor DeSantis moved back to his, earlier position about letting local counties, make those kinds of calls in response to COVID-19 and emergency actions, because, that was his approach from the very beginning. Initially when we saw those numbers rolling in, he decided to have a statewide order and decided to make statewide calls, but he's shifting back as he's allowing the economy to reopen to more localized decisions. And with a pandemic like this, with our population makeup the way that it is, it makes perfect sense. So I'm glad he's actively working back to getting Florida's economy reopened, and I'm glad he's letting places like Northwest Florida, which have seen a far fewer cases than South Florida,
Yes.
start opening up sooner.
Absolutely. And I wanted to allow Janice a chance to segue in on that. And one thing I want to throw out there, and I appreciate your candor, Representative Andrade, because, obviously the governor's not a perfect person. None of us are. No one's perfect. Only God is, right? But well, a lot of people are telling me, Jeff, this checkpoint at the highway is a joke. It's a joke. We're paying $50 an hour to officers to sit there. They're like, hey, where are you from? Okay, quarantine for 14 days. There's no follow-up. There's nothing like that. What's your thoughts on that, Janice? And what's your thoughts on that, Alex? I think, if we're not going to follow up with a guy who's coming from a hot spot, then what's the point of stopping him there and stopping traffic? There are people that commute back and forth from Mobile to Pensacola, and they think it's a joke. What do you all think about it? Has it been effective? Has it helped? Is anyone following up for people, making sure that they're going to self-quarantine for 12 or 14 days? Your thoughts, Janice, and then I'd like to get your thoughts.
Yeah. So what I would say is that I'm not convinced that they aren't following up. I know that they were following up for sure in the beginning. So I'm not sure I would take that as a valid concern. I think that all the intentions were very well placed in the sense that we wanted to protect our community from folks that, while they may have been well-meaning to come and visit us, they may have been bringing something, like Alex said, just a couple of short weeks ago, we weren't quite sure what it meant when somebody traveled from a hot spot to our community, and there were a lot of people that were very panicked about that. So I think that one of the things is I think we have to say we've learned a lot of lessons from this experience.
Yes.
And so we are, like I said, taking notes, keeping a playbook for praise. I hope to goodness we don't have this in the near future. I hope it's something that our grandkids may be able to open the playbook and say, hey, this is how they did it 100 years ago. I really don't want to go back through this again, but I will tell you this, we'll be much better at it the next time than we were this time.
That's true. That's a good point.
So I'm not going to sit here and throw punches at decisions that were made over the past 10 weeks, because I think that we did, and I think the governor did what he thought was the right thing to do at the time. And I think there were a lot of citizens that also thought it was the right thing to do.
Alex,
So
what do you, Representative Andrade, what's your take on that?
From that perspective, yeah, I'm just saying, from that perspective, I think you have to take it for the intention that it was. Mm-hmm. And I was under the understanding that people were being followed up with. So if they're not being followed up with now, that may be a new development in the past month. But I know that when it first started, they were being followed up with from conversations that I had. So
interesting. Yeah, it's my understanding they stop them now. They ask where they're coming from, and they tell them to voluntarily shelter in place or self-isolate for 14 days, but no one's looking behind that because of course we don't have the resources to do it. And so they're going right to the beach or the vacation rental, or they're saying they're from, anyway, I just think I think it was well-intentioned as well. And I'm not the one who's throwing punches. I'm just saying I'm getting that from a lot of people, particularly people that come on a regular basis from Mobile, and every day they're stopping. And I know it's inconvenient. I know it's well-intentioned. And I agree with you, Janice. I don't want to lob punches at people either, and there's a lot of lessons we will all learn from this. But at some point, I think you have to modulate the dial and figure out what's working, what's really a big expenditure of taxpayer money, $50 an hour for people to sit there and, if nothing's going to be done. But Representative Andrade, what's your take on the checkpoint? And they're not hitting every road either. Some roads you can get in, some roads you can't. I mean, there's workarounds all over the place. What's your take on it?
Yeah, so I think one thing that needs to be provided is some context, right? So when this checkpoint was initially put in, people thought that somehow this was going to, we as a state, one of 50 states that, while our state constitution has the police power and is very powerful and has all authority, almost all authority outside of what the federal constitution allows the federal government to do. Barring interstate travel was not something that was intended with this executive order, and people seem to miss that. And I think that honestly, one of the more fun things about COVID-19 and the responses from all these different levels of government has been the amount of conversations I've been able to have explaining our system of checks and balances, our federalist system of allowing the federal government certain jurisdiction and the states others. You cannot bar an American citizen from traveling between states.
Bingo.
Not going to happen. It's part of our U.S. Constitution. It's not going to happen. We as a state just can't close our borders to other states. That was never the intent. And if you thought it was, sorry. But the other context that needs to be provided is if you are coming from a hotspot, you tell the Department of Health official that you are coming from a hotspot. You fill out your form. You have to list the address of where you're staying, and that address is kept on file. And by the way, the form that you're filling out, where you say what address you're going to be at, says that if you're not there, self-quarantining for 14 days, it's a second-degree misdemeanor, punishable by a $500 fine and up to 60 days in jail. And FHP has that on record, the Florida Highway Patrol, and they have investigators. And yes, absolutely, that's on file. They can go knock on that door and see if you're there. So whether or not an FHP investigator is going and checking and knocking on those doors every day is a question that I can't answer. The only people that can answer that are probably Department of Health and the Florida Department of Highway Safety. But I mean, I think it had somewhat of an effect. It took down the amount of people who were comfortable coming here. I know personally it kept some people from Pensacola from visiting those areas and then coming back. So what effect it actually had, I don't know. But it definitely gave me an opportunity to explain the difference between our federal U.S. Constitution, our state constitution, and the powers our local governments have.
It's a civics lesson.
Yes, civics lesson. Hey, I have a question for either of you from Tim on my Facebook feed. He wants to know what's the overall accuracy of the tests being given, and has the turnaround time come down at all? Because remember initially it was 7 to 12 to 14 days. Do we have the rapid tests? And Janice, is that a question you can answer? Do you know?
I cannot answer it completely because I think we're still in the phase where some tests are going off to national labs, some tests. So like if you're a first responder, we have a certain batch of tests that you can take with Sacred Heart that they've provided to us. And so those do have a quicker turnaround. But as far as en masse, I don't know that answer. I've not had the call. We usually have a Monday call with the hospitals. I've not had that call this week because we took Monday off, so I'll have the call next week. But it's my understanding that they are getting quicker, but so it's more like a 3 to 5 day turnaround versus previously the 7 to 14 day turnaround. But as far as a percentage of the tests that are being taken, I don't know that. But I think most folks are hoping to get their employees back in the office quicker because, it's detrimental to the employee to be out if they're not showing any signs and, they don't necessarily live in a household with somebody that has it. Maybe they were in an office next door to somebody that has it, which is a less likely chance you're going to test positive. Keeping people out while you're waiting for the returns is kind of, it's difficult financially, but also not only to the employee, but to the employer. So I know that everyone is working really hard to get the test back quicker. I just don't know it as a percentage of the tests that are being taken.
Representative Andrade, do you have any thoughts on that one?
Well, yeah. So one, Janice is right, because tests are going to so many different places. I think Abbott Labs, those kind of rapid test turnover kits, I think the state maybe has up to 20 now, but maybe more. Those get distributed to different emergency management centers around the state or different hospitals. We tested, I pulled up the dashboard. We tested about 70,000 people in Florida the week of April 20th. And this week we've tested about 125,000 people. So we've gotten results back for over twice as many people this week than we did on April 20th. So regardless of where those tests are getting sent or how they're being collected, we're getting data back for almost twice as many people this week than we did 3-4 weeks ago. And we're nearing that million person mark for how many people we've tested in Florida. So that's, 5% of the population already that could have potentially been tested. That's the testing capacity is dramatically increased.
I think that's incredible. What an incredible statistic there are countries that haven't come close to what we've done here in the state of Florida. And I was looking, and that dashboard, by the way, is a great resource to anyone who's watching this. You got to go look that up. It's the Florida Department of Health, and there's also Johns Hopkins University has one very similar for the world, and you can travel around the globe and see how other countries are faring. But I know here in the state, or here in Escambia County, we've because I looked at it this morning and getting ready for this. We've tested 18,320 citizens here in Escambia County. And unfortunately, we do have 769 cases of positive tests. But I will point out, and this was reported in the media last week, 75% of those are in long-term care facilities, convalescent homes, things of this nature. So to me, that's a pretty stunning statistic. What do you all think of that? I mean, 3 out of 4 are in these, close quarters, long-term care facilities. To me, that gives me a little bit of comfort. What do you all think about that?
So Dr. Lanza, on one of our last calls, he did specifically mention, and I think I might have mentioned this before, that you have a better opportunity of actually testing positive. So like you, Commissioner Bergosh, if your wife had it, it's a better chance that you would test positive, or one of your sons, because of the close proximity in which you are residing. Whereas in my office, if my assistant was positive, there's less likely a chance that I'm going to test positive, because we're really not in the same office. And even though we're here for a number of hours a day, we're not in that close proximity. So that's why congregate living, residential, in your homes, that's why I think the universities had to take such drastic measures to get folks out of the residence halls. That type of living is what has tended to be more of a determination of whether or not you tested positive. So I think, now that was as of, a couple weeks ago when we had the conversation. I'll check, next week and see if that's still bearing out. But that does tend to be a predictor. And I can just tell you anecdotally from our experience here at the county, whenever we have had someone test positive and then we've had their suite mates or the other folks in their offices, so far we're not seeing that they have been impacted and they've also tested positive. So we're also seeing that.
Representative Andrade, what's your thoughts on that?
Well, one, I'm really glad that our governor never sent anyone who tested positive for COVID-19 to a long-term care facility like some other states' governors, who might be more popular in the national media. But no. So the more that we learn about COVID-19, the more prepared we are to respond going forward. We knew that it was going to be particularly dangerous for people with compromised immune systems, people who were senior in age. And it's bearing out to be true. I've had several constituents call me concerned about their children who are serving time in Florida prisons because Florida prisons have the same type of environmental issues that long-term care facilities have. And just making sure that those kind of vulnerable populations, the populations that the state's responsible for their safety, are being covered in some way is still going to be a concern. And it's something that, when I'm dealing with constituent work, I have to focus on. But it bodes well, I think, for Florida's economy. We're sales tax dependent. We want people feeling comfortable to be coming here. And we have to make sure that it's safe when they are here. So the fact that, there's not much community spread in the general community is probably a good thing for our economy. I'm not sure what that means necessarily for the years ahead. I'm sure both of y'all have heard the term herd immunity.
Oh, yeah.
We need a large population of people who have these antibodies built up in their body to avoid a completely vulnerable entire population. So young people contracting COVID-19 is probably not the end of the world. And the higher percentage of young people contracting COVID-19, so long as they're not, able to spread it after they're immune to it, will be a positive thing for Florida in the future. So getting that data as well is going to be critical going forward. But no, I mean, the effect on the economy, once the executive orders are all lifted or essentially lifted, is going to be largely psychological. And, making sure that people are comfortable being here in Florida is something that we have to focus on.
Great answer and really well thought out and very intelligent, man. And I agree with you on a lot of that. One thing I will point out, since we're talking about executive orders, is, we as commissioners, we really got pilloried at meetings. We get beat up for a lot of things that aren't our fault. And I guess that comes with the territory. I'm sure you get your share of that as well.
No, it's all my fault. Yeah,
everything's your fault. Well, but one of the things that we get beat up for is, well, why'd you shut my business down in Escambia County? And we didn't. I want people to know that we didn't. And I say it every time I get a chance to say it. I say it. We didn't close your restaurant. We didn't close your bar. We didn't close your hair salon. We didn't close your doctor's office. We did none of that. The only thing that we did was we listened when the presidents of the 3 major hospitals in Escambia County begged us to close the beach down. They didn't want more spring breakers coming doing group wrestling matches. They were freaked out. And, the health department director, they wrote us a written letter, please close your beach. The sheriff came, closed the beach. So we did it, but then we reopened it, but we didn't close anyone's business in this county. And you talked a little bit about the federal system and things like this. You followed the governor's executive orders. I know in other states, people have, done some civil disobedience, and one young lady got arrested. Of course, the governor in that state is a great guy, and he went and bailed and said that ain't going to happen, and knocked her out and got her out of jail. But I want everyone to know the Board of County Commissioners of Escambia County didn't close anyone's business. I was wanting things to be opened. And I personally think, by personal opinion, I don't know what you guys think, but, maybe if we have a second wave, maybe this time around, the folks with compromised immune systems, those in vulnerable conditions, medically compromised, maybe they're the ones who shelter in place and the whole world doesn't get shut down. That's kind of, maybe that's just one guy's opinion. I'd like to know what y'all think about that, because that is one of my questions. If we have another spike in the state of Florida, Representative Andrade, we'll go to you first. Do you think we'll have a second shelter in place order, and will it be as widespread as the first one, or do you think we'll target it this time and use a scalpel instead of a club?
That's a very good question. Historically, I think I was watching y'all's county commission meeting when you were initially talking about, shutting down the beaches. Didn't the executive order shutting down restaurants and bars come out during y'all's meeting, so that it was kind of like taken off the list of issues that y'all even had to consider?
True.
We at the time, you saw, and I'm not the biggest person for casting aspersions or making things overly political, but you did see a dichotomy in leadership, right? You had Democrats in leadership in the state of Florida, like Nikki Fried. We're calling for statewide shutdowns far before Governor DeSantis actually made the call. And again, there's only one justification for doing something like this, right? The justification was we were receiving data from experts that we relied on, that if we did not do something, dramatic to slow the spread and flatten the curve, we were going to have an overrun in our hospitals, and we were going to be facing a much more dire situation than we were based on the data that was coming in about actual infections. The state spent $280 million on emergency hospitals in some of our larger cities that, thank goodness, we never had to use.
Right.
But we were preparing for a much different scenario in May when we were back in March than we're seeing now. And so there was based on the data and the information the governor's office had, they felt justified in making the call to close those restaurants and bars and other industries. And there's one key point, because a lot of people like to talk about their freedom. Most of these executive orders have nothing to do with any of your constitutional rights. They're based in the licenses that these businesses have to maintain with the state. And no one's saying that they shouldn't have a license to operate in the state of Florida, because people understand that there's, public safety and welfare that the state is required to maintain to protect, the community at large. So those licenses were at risk, but people's constitutional rights were largely unaffected by almost any of the executive orders, at least that Governor DeSantis put out. But no, I don't think that going forward, based on the information that we now have, seeing the spread that we have now seen, that we'll be going back to any type of shelter in place or going back to any type of shutdowns of businesses at large, unless there's a dramatic uptick, a dramatic spike in infections, in the death rate and hospitalizations. I don't think the justification's there anymore. And thank goodness our governor is, one of the most conservative governors in the country, and he's been approaching it that way. By and large, I've been very appreciative by how he's approached reopening Florida's economy, and I was very appreciative early on by how he left the decisions to close beaches, to close certain industries, to local governments, because he understood how diverse our different regions of Florida are.
No, great answer, and I agree in large part. The only thing I would say is, and you could say, well, your license is at risk, but you could do it. But I think those things are intertwined. If I lose my liquor license, then my bar is closed. So if I want to be a rebel and be, socially disobedient, I want to open my bar, it's easy to say that I'm not taking your constitutional right. I mean, I'm disagreeing with you a little bit here, Representative. Because
you have a constitutional right to sell. You have a constitutional right to sell liquor in Florida.
Well, no, but I mean, but you have the right.
Go back and look at that Bill of Rights, see which one enumerates that.
Well, okay.
Right to happiness.
But no, I do appreciate that. But I do think it's a lot of times it's easier for someone on the sideline to say, go ahead and open your restaurant or open your bar or open your hair salon like the lady in Dallas did. She made a stand. I have a lot of respect for her, by the way. And I love that governor over there, Greg Abbott's, a great guy. I think he does a great job. But I'm glad that he bailed her out of jail, because, she was struggling. And that's the thing. A lot of these people are struggling, especially restaurants, especially bars right now. And they're looking at, and Janice, I'm going to give you a chance to weigh in on this, but I'm going to ask Representative Andrade this, though. If I own a cocktail lounge and I don't serve food, and right next door, there's a restaurant that serves cocktails, and we both have patios right now, the restaurant can serve margaritas on the patio just because they have a different kind of license, but the bar can't serve cocktails on the patio. I just think that's a problem, and I don't understand why that is. Janice, help me understand. Am I seeing that wrong, or is that just something that I have a blind spot?
I think if we go back to the beginning, I think that the main denominator in the whole decision related to bars was the fact that people were congregating, right? They were, right. And you get hot, you get close, there's a lot of things that happen in a bar that at the time, I think we thought contributed to the I don't want to say contamination, but the getting folks contracting the COVID. And so I think from that perspective, I think that's why they made the decision they made. And plus, remember, it was spring break time. We thought all these irresponsible young people were not going to follow the rules. You know what I'm saying? So when you,
Right.
I think if it had been November, December, maybe we'd have had a different, perspective. But because there was so much pressure on the state of Florida, because we are such a hotbed for tourism and young people, I think that's what exacerbated the situation. So I think that if I had to say the number one reason why I think bars were treated differently, I think it's just the folks getting really friendly in a very close environment is a little different than adults enjoying a margarita with their meal on a patio.
I think,
That would
well,
just.
I hear what you're saying, but I think the owner of the bar might have a different perspective on that.
Yeah.
So, hey, Janice, since we're running low on time, I'm going to go like lightning round questions now. So do you think, Janice, as the administrator of Escambia County, that if we have a second wave and a second spike, because as I looked at the dashboard this morning, I hate to be the bearer of bad news, and I'm not a scientist, believe me, I'm not, but I can look at a chart and I can see a trend, like a trend line for a stock chart. And it looks like, it just seems like there's statewide, there's a tick upward of new cases. I don't know. I could be wrong. You look at it and you tell me what you think. I mean, if nothing else, it's sideways. It's certainly not going to, now deaths have fallen off the cliff, but the new infection, anyway, the question, if we have another spike, Janice, what do you think? Do you think we'll have a statewide shutdown, or do you think it'll be a little more targeted this time around, as Representative Andrade believes?
I agree with Representative Andrade. I think that the governor has been very thoughtful, very meditative. I mean, I think he has taken information. I don't think he did things in a knee-jerk way. I think what he said is we need to look at this information. And now we have 10, 12 weeks more information than we had when we started. And I just want to say again, you talk about certain things every time. I do too, which is our county employees, our essential employees have done a fantastic job. They've maintained their work. Like I said, we've only had maybe 45 employees that have compromised immune systems or maybe have issues that have required them to be out. And we only have about 35 that have taken advantage of the stay at home with their kids, that. And so we've done a great job as a county, as the essential employees to maintain our work. And they've enjoyed doing it from what I've been told, because they don't have a lot of catch up to do, but also they know that they've been a huge contributing factor to keeping our community going. So from my perspective, and other essential like contractors and construction, and those folks have appreciated the opportunity to continue to go to work. And so I think people that have had something taken away from them, which is not to be able to work, I don't think they want that to happen again. And so I think there would be more pressure on all of our elected officials, including the governor, not to take such, I don't want to say draconian, but draconian measures next time. I think we've learned a lot. How to social distance, how to, maybe not touch a lot of things like we used to, and maybe kind of give ourselves a little bit more space. And I think given those kind of restrictions, I think we certainly would not see the same kind of shutdown that we did this first time.
Well, yeah, I mean, no doubt about it. That's a good point, and I agree with you on that. Let me ask you this question, Representative Andrade, because this is one that we're all talking about. Our state budget this time around, close to $92 billion, something like that. Very close to that. When I first became a public official in 2006, I remember it was a record. Oh my gosh. In the budget, I was on the school board, and the budget was $67 billion. And I mean, we're a conservative state, and I love the fact that we live within our means. We balance the budget every year. We're not like other states that send their retired employees IOUs when the going gets rough, and then they're expecting all kinds of federal money and bailouts. But Disneyland's closed. Orlando's shut down, right? That's going to have a massive impact. International travel is down like 70%, is what I was seeing on CNBC. What is going to happen with our budget? When are we going to have a special session? How bad is it going to get? And are we going to be penalized and punished for having a rainy day fund and being fiscally conservative, where other states are spent all their savings and are going to go run for a federal bailout? I know that's a loaded question with a lot of stuff to unpack, but I'd love your opinion on that.
Yeah. No, it's not a loaded question at all. Florida's one of the best states in the country as far as our fiscal conservatism. We have over $3 billion in reserves.
Is that going to be held against us, though? Is that going to be held against us? I mean, in other words,
the state and local tax deduction for decades has been held against us, right? And thank goodness the Congress did away with that after President Trump was elected. He made it a priority. That's why we see almost 1,000 people moving to Florida from some of these high-tax states around the country every single day. People come from California, New York, New Jersey, to leave those types of systems, and they come here, for the quality of life and for our system. I don't think anybody's looking at the Florida legislature and saying, I want to move to Florida because of the Florida legislature, but they're coming here because of our quality of life, because we don't have a state income tax, because we do live within our means, and because we're not overly invasive with the restrictions that we put on Florida citizens. No, so the budget, absolutely. It's going to be a concern going forward. Whether or not those pay raises that we committed to this year are going to be on the chopping block or not, is a little bit above my personal pay grade. But when you again look at our general revenue, which is going to be the one most affected, by COVID-19, the biggest draw on that obviously is education. And we're going to have to figure out how to adjust it. One thing that I'm personally proud of, just to put this plug in, is this past year, our education system, our school districts around the state have had these unfunded mandates from the state of Florida for several years to provide health care to students, mental health, physical therapy, speech pathology, and transportation at different clinics. And we never allowed school districts to bill Medicaid for those services if that child was Medicaid eligible. I passed the bill this year after identifying that issue, to allow school districts to bill Medicaid for the services that Medicaid would have otherwise been paying for if that child went to a clinic. So I believe Superintendent Thomas said Escambia County would realize about $800,000 in savings every single year going forward.
Nice.
And overall, the state and school districts around the state will realize about $50 million at least in savings going forward, because Medicaid, which should be paying for this service anyway, will actually be reimbursing school districts who are having to pay for these services out of their base student allocations. So, it's minute, small little policies like that the Florida legislature, focuses on every year to try and help be more creative going forward. So while the $500 million might be on the chopping block this year as far as starting teacher pay, depending on when we have a special session or if we have a special session, there are policies like that save the state $50 million a year that are still going to be rolling out every single year from legislators who care. So I think that we'll be in a good position going forward, but our budget's going to be smaller than $92.3 billion next year.
Right. When do you think that special session? When do you think that special session is going to happen?
So the budget for this year ends June 30th. Next year's budget starts July 1st. The federal government, like I said, has allocated to the CARES Act about $8.3 billion for the state of Florida. Depending on just how restrictive the federal government decides to be with a lot of that money, we might not have to have a special session. If Governor DeSantis has to have the leeway to is allowed to have the leeway to spend that money how he thinks he needs to, we might not even have to come back.
I know Janice. I apologize. I know Janice wants to jump in. Last week we had this conversation. She's dying down there because I know she wants to crack at you, Alex. She wants to ask you a question. Okay, Janice, you're up. Ask that question.
Yeah. So, Alex, I'd be more than happy to share some information with you. Governor Abbott in Texas took $1.8 billion of their allocation, and he has assigned it to communities under 500,000.
Yes.
And so, what he did was it's $55 per capita allocation. So just so you'll know, for Escambia County, that would mean $17.4 million. And so, I am very fiscally conservative as well. Okay. But when I see a community like, Imperial Polk County get $126 million, it's disturbing in the sense that, I love Imperial Polk County. It's a wonderful place, but I feel like we're just as great. And so, the fact that we were kind of carved out of that is, and Escambia County, we are one of the ones I would say is a mid-sized county for the state of Florida. So we are one of the ones that kind of got punished because we're under 500,000. And I would even be willing, look, if they would be willing to say, all right, we're going to smush Escambia and Santa Rosa County together, that gets us over it gets us really close to the 500,000 mark. But anyway, I was going to send you that information just so y'all could see what Governor Abbott did. And I am also sharing it with the governor's office, just because, I would just love the consideration. So,
Yeah.
Well,
you'd even take $50 a person. Okay.
What do you think, Alex? Is that something we can, work on?
It depends on if the governor lets the legislature make those calls.
I know.
But no, and it's not even just, I mean, Polk County got that money. Hillsborough got $256 million. Brevard got $105 million. You have regional pockets around the state, like the Tampa area, the South Florida area, the Jacksonville area, where you have several counties getting these direct distributions. And then the largest MSA in the Panhandle left out. We're, what, 7 hours away from any of those other kind of pockets of population. So no, you're not wrong. But I am appreciative of how responsive, Secretary Beshears has been at DBPR, the governor's office, his chief of staff and his entire team. They've always responded to my calls. They've always responded to my texts. They're not required to do what I tell them. I'm not their boss.
Oh, I know.
But no, I've always appreciated the fact that they've taken my input. And actually part of this, the direct payments to local governments, I've discussed it with several people in the governor's office already. I'm not sure what they're going to do, but they've definitely heard me. And, I'm going to continue doing my job as a representative to make it clear. I haven't specifically said break it out by, you said $55 per head.
Yeah, I'm going to send you the link so that you can see what they did.
Yeah,
and they just
I want to point something out real quick. I got a text message I didn't see from, I'm not going to say who it was, but he wanted me to point out to Representative Andrade that you do have a constitutional right to sell alcohol in Florida. It's called the 21st Amendment to the U.S. Constitution. That's right. That ended prohibition. It allows states to create legislation to promulgate rules to regulate alcohol. So not the
possess and consume. Possess and consume is different than sale.
Oh, okay. Okay. Well,
you don't have a right. Yeah. Like right to engage in commerce without a license is not, you don't have that right.
That's right. I know you're a lawyer, so I definitely don't want to get mixed up in the law with you because I know you, but this is from someone else, from a friend. A friend wanted me to point that out to you. Hey, we are running out of time, but this is a serious question. And it's coming around nationwide. Everyone wants to know this question, with everything that happened with COVID and the hospitals and people trying to get care and not being able to get care. And now the nursing homes, will there be some sort of an amnesty bill that will be run through the legislature to protect the hospitals, the doctors who are just doing the best they can? Now, this might be more applicable in places like New York where they totally got overrun and had people in the hallways. I don't know that we saw that here in Florida, but Representative Andrade, do you feel there will be any kind of an amnesty bill to protect doctors, hospitals, and nurses from any sort of litigation based upon the COVID and the way they responded?
There will be a bill. I don't know if it'll pass. It depends on what that bill says, right? I mean, if you're going to say that a long-term care facility is exempt from engaging in gross negligence, if it can be proven they engage in gross negligence, raising to the level of recklessness, I don't even know if I would support. I don't think I would support that. I mean,
that's a good point. Yeah.
I mean, there has to be some standard. It has to be vetted. The great thing about the legislative process, rather than these executive orders, like you mentioned the bars, and I can wax eloquent about the difference between bars and restaurants and why the executive order was passed the way that it was. I'd also like to give another shout out to Halsey Beshears, who's done an incredible job responding to me every time I've bugged him about it, because he'll always find a workaround. And I've appreciated what he's done the past few weeks for especially the bars in areas like Pensacola. But no, I mean, the great thing about the legislative process is you get a bill, it gets assigned at least 2, usually 3 committees. It gets vetted at each committee stop and has public input at every single stop. It has to pass on the floor of whichever chamber it's in, and then it has to get sent to the other chamber to have the exact same process gone through. So our bills have a lot more thought put into them than especially executive orders, and they're supposed to be. And even then, legislatures get it wrong.
Right.
Things aren't fully thought out. But no, a bill for some type of amnesty, for some type of cover, it's probably going to come. I've seen a lot of advocacy for it up to date. But what it actually looks like at the end of the day is anybody's guess. But no, I don't think I'd support a bill to let anybody off the hook for anything that rose to the level of gross negligence or recklessness.
No, that's a good answer. And that's what I was curious about. I've seen it. I think it's more of at the national level, but I didn't know at the state level if they were going to do it. Hey, a local question, and Janice can weigh in as well. We've had water systems here in Escambia County that have failed. And then the way the law is written, we end up being the receiver because we're the county, because most counties throughout the state do sewer, water, garbage, but we don't. We have a utility authority. Some things happened in the past here at Inverarity Island before I became a board member, but we're paying the costs for it now. We're carrying debt now. We're having to dump a lot of costs on private citizens who, anyway, it's really ugly. And I'm seeing and I had an anonymous comment on my blog that wanted me to ask you and or Senator Broxson about Century in particular, the water system up there, the Correctional Institute, they're having problems, the wastewater treatment plant. Is there some state funding? Because, you know, if something happens to Century, what worries me is guess who gets it, right? And we'll fight that. I know I will. I don't want another Inverarity Island. We don't run water, sewer, garbage. That should go to ECUA. That law should be changed. And I don't know how that ever got lassoed around our neck like an albatross, but we're paying the price for it. And I've had subdivisions in my district where they had private utility lift stations, and the poor citizens got hit with the charges to fix those things. Anyway, it's a bad problem. But as it relates to you at the state, Representative Andrade, is there any thought to helping Century, their water system, and can we get DEP grants to fix these septic systems on places like Inverarity Island instead of dumping the MSBU's and big charges on the citizens that live there? Any thought on that?
Well, yeah. So this past legislative session, and I haven't done the research, but I haven't seen it ever happen. Was the first time, from what I can remember, that we've gotten any money worked into the state budget for septic to sewer conversion in Northwest Florida. I was able to get money for septic to sewer conversion within Brownsville, for that commercial corridor in Brownsville. So there's money there. Usually the money goes to South Florida, for things like septic to sewer. Century's obviously not in my district. That's farther than that's up in House District 1. My district pretty much ends at I-10. There's money there. There's grants there. This is actually one good opportunity to just highlight for everybody who's watching that if you want to get money out of the state, the best opportunity you have is not during legislative session asking your legislator just to work something into a budget, right? Because that a lot of times the dollar amounts that we're talking about that legislators can individually get for these kind of projects, they're really small dollar amounts. The real way to work it is, like you referenced, DEP grants or other state or federal grant opportunities that are out there. The problem that you might have is those take a little bit more work, right? You have to do your own research. You have to go look into them. You have to see if you qualify. You have to go collaborate and get a group together of different stakeholders that might actually have to have input in the process. But yeah, shoot, in Santa Rosa County, between Holly Navarre, Gulf Breeze, and in Santa Rosa County, our friends in the military, we were able to work out a really great opportunity to actually get Holly Navarre's water system funded and allow for reuse sprinkler water in Gulf Breeze in the process. And the state will hopefully be able to fund a significant portion of that because they have a type of grant that they qualified for after we worked through the application process. So yeah, there's definitely opportunities there. You just got to get creative, do your research, know all your stakeholders, and work through the process.
Good answer. Good answer. And I know that there's a lot of folks up in Century that are working hard on that. Inverarity, that was unfortunately 4 or 5 years back, but there's still some meat on the bone so far as I'm concerned. Janice, did you want to weigh in on that? Do you have any thoughts on that? Because if Century goes sideways, don't we end up taking it? I hope that doesn't happen. I hope they work out all their whatever issues the case might be. But your thoughts on that?
So we have applied for grants for the sewer for Century, and we have, I don't want to say been guaranteed, but I would say because we've already provided the match for that, I feel confident that we are going to get those grants.
Okay.
But it is specifically for the sewer. It is not necessarily for the water.
Okay. Well, I can't believe an hour went by so quick, and we didn't even have Senator Broxson here. Representative Andrade, I can't thank you enough for what you do for the state, your service over there in Tallahassee, carrying all the appropriations bills, the hard work that you do. You don't get, no one really, things that you do like that school district bill where you got the Medicaid reimbursements. That's huge. And, the media doesn't cover it. And that's a shame because that's great. I'm glad you shared that. That's a great story. That's a win statewide. And was that a bill that you sponsored?
Yeah, that was my bill.
Wow. Fantastic. Well, keep up the great work. We appreciate you being here this morning. Janice, as always, thanks for being here. Next week, we're going to have a great show. We're going to have economist Rick Harper here. and also a restaurant owner, real estate mogul, Collier Merrill, a local guy that everyone knows. And we're going to talk about COVID-19 and the economic impacts locally and regionally. And I just can't wait for that. I'm really excited about that show. I love economics, love macro, it's just an interesting topic. So if you have questions, please, by all means, email them, or you can text them to me, or you can hit my Blogger site and let me know. These are two really intelligent guys that know a lot. And any questions about the economy and the impacts of COVID next week, you'll want to be here to watch it. Representative Andrade, have a great summer. Thank you for all you're doing. Janice, thank you. And I hope you guys have a great rest of the week. And thanks again for getting up early and being here. I really appreciate it.
Alex.
All right,
Thank
guys.
you.
Have a good one. All right. Bye.
Bye.